Cancer rates are rising around the world, and a new survey says less and less women are getting tested for any form of the disease. The Hologic Women's Health Index finds in 2022, 10% of women reported getting tested for cancer. That's a drop from 12% in 2020 and 2021. The American Cancer Society predicts 2 million new cases of cancer in 2025 and also predicts 600,000 cancer-related deaths this year. The decline mainly reported by women over the age of 40 years old. Dr. Richina Bicette-McCain is with us to talk more about it. Pretty concerning to see this drop. What do you attribute to fewer women getting checked?
Concerning, Marni, but I don't know if it's quite surprising. This data is from a survey that was done in 2023, so we were still reeling from the impacts of the pandemic. But if you delve deeper into the Hologic survey, they also revealed a lot of other interesting data that I think is playing a part here. Of course, there are healthcare related issues such as insurance, cost of services, access to healthcare, and availability of appointments. But the Hologic survey also discovered that there are a lot of needs that women have that are not being met. Women are reporting that they can't meet their most basic physiological needs. Almost 40% of women said that they haven't had access to food within the last year. Almost a third of women have said that they haven't been able to afford housing. About 40% of women are reporting that they feel unsafe. And if you look at our hierarchy of needs, physiological needs and safety needs are the most basic. And if we can't focus on those, excuse my idiom here, but I think women have more fish to fry if they're worried about food, shelter, and safety than preventative health care.
Yeah, medical goes to the back of the line when you're trying to meet those basic needs. So what is your advice to women? Because if you don't diagnose some of these things early, it can really have a dramatic and devastating impact.
Of course, there are the general things that we talk about most often: increasing access to healthcare, raising awareness for preventative healthcare, and reducing disparities in healthcare. But again, when we look at some of these data points from the Hologic survey, it shows us that issues related to healthcare are not the only things at play here. What are we doing as a society to help people who have food and shelter insecurities? How are we increasing the safety of our population, or the fact that women don't feel comfortable with the quality of healthcare around them? We need to address those basic facts as well as addressing the healthcare related issues.
And how do you bring those two together? The medical community, how do you see advocating for meeting those basic needs and reconciling the balance?
Well, Marni, I say all the time that the United States is a stark contrast to other parts of the world, because I feel that we have a preventative care system, a sick care system instead of a healthcare system, meaning that instead of focusing on preventative care, most people start to seek healthcare and health advice when something is going wrong or when they're sick. We need to start focusing on preventative healthcare, because a lot of cancer risks, almost 40% of cancer risks, are due to modifiable factors such as smoking, obesity, alcohol consumption, etc.
And should those preventative measures be made more accessible, more affordable?
Marni, absolutely. And recently, it seems as if we're going against that change. For example, this survey has shown that cervical cancer rates are increasing, specifically amongst women who are ages 30 to 44. Previously, insurance coverage would cover pap smears, which is the screening test for cervical cancer, once a year. That has started to decrease, and we're seeing multiple insurance carriers, including Medicare, changing that screening to every 2 years. Insurance companies also are very clever with the language in that they will pay for preventative health screening. So if you're going to get screened for colon cancer, which is now the #1 killer amongst men, #2 killer amongst women under the age of 50, they will pay for screening for colon cancer. However, if you have an abnormal screening test and then have to get further testing, it's no longer screening, it's no longer preventative. Now it's classified as diagnostic, and thus patients incur significant costs. So those are the kinds of things I think that halt people in the healthcare system.
Yeah, well, what a mess. But I appreciate you highlighting some of the reasons why and how we get out of it together. Dr. Bicette-McCain, as always, thanks. I haven't seen you in a while. Good to chat. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.